Dr. Vikki Petersen here. A reader writes in, how is wheat-free different from gluten-free, and how do I know which one is best for me? Typically when people say they have a wheat reaction, they're really looking at a wheat allergy. And an allergy is very, very different from a sensitivity. First of all, an allergy is mediated by a response in your immune system called an IgE response. So that's a part of your immune system that's reacting to the substance, whether it's wheat, dairy, corn, soy, things like that. And the reaction tends to be fairly dramatic, usually fairly quick in the response, and someone could get itchy skin or runny nose and these types of reactions, and they do tend to be rather quick to respond. An IgG response or an IgA response, as we see with sensitivities like gluten, tend to be less obvious than that as far as runny nose and itchy skin and hives and things like that. Not that there aren't skin conditions associated with gluten sensitivity, but it's not that immediate. Sometimes people with peanut allergies have trouble breathing. So these tend to be more immediate and dramatic responses. A sensitivity can be very serious response, but not the same. Okay, so they're very different as far as how they're mediated or how they're responded to by your immune system. So the first thing to find out is, do you have an allergy or a sensitivity? Now, an IgE allergy, those are pretty easy to find out. There are blood tests that can be done and scratch tests that can be done. Scratch tests are better for environmental type allergies, but blood tests and IgE blood tests will absolutely show you those reactions that are true allergies. Although, typically, you know if you have a true allergy because of the response being so dramatic. So if you're not aware that you absolutely have a wheat allergy, you probably don't, but you can definitely do that blood test, and that's simple. I wish detecting celiac and gluten sensitivity were as simple. So let's talk about that now. So if you're wondering if you more have a gluten response and not a true allergy, so a sensitivity, then there's a myriad of tests that we've talked about in the past. So you can be having a gluten problem due to celiac disease, and there's a blood test which is called a TTG blood test that you can do, and that's fairly indicative of celiac when it's in a very serious state. So it has to be pretty advanced before that blood shows positive. There's the intestinal biopsy that's done. Once again, has to be pretty serious, pretty advanced before that shows positive. Then there is the immunoglobulin G, so the IgG and IgA blood tests. Those are more sensitive for gluten sensitivity, and you can do those via blood, saliva, or stool. There are laboratories that offer all of those versions. And then there's also an IgG deamidated, so it's two D's, D-E-A-M-I-D-A-T-E-D, sorry, three D's. Anyway, the IgG deamidated antibody test, which is a blood test. It is that IgG, but the deamidated portion of it means that it's more sensitive for celiac disease. And that's considered a more sensitive test for celiac, which is important because the sooner we can diagnose you with either celiac or gluten sensitivity, the much better your health is going to be. And there's so many different studies that point to the fact that early diagnosis is really what we have to strive for. So, and remember, the gold standard also for gluten sensitivity is simply removing that gluten from your diet and feeling better, so you know that you're reacting to gluten. So I hope that helps, and until next time, I wish you very good health.